just want to recognize that today's a big day because we're going to reflect on some successes the board had in getting its allocation plan approved by the legislature, but also a really good day because one of the things that's always been an interest
My headphones
to me.
working.
Oh, hold on, we're having a little bit of background noise.
Mhm.
So
Which means I can sit in here by myself and just.
and I'll use that as just a quick reminder that today's meeting is being hosted live by CTN. So that means if we could make sure that we're introducing ourselves and saying our names when we speak, it'll make it easier for them to do the captions underneath and to call out who's speaking for their feed, as well as for our record taking and note taking purposes. It helps following the conversation. So with that, I want to have Melissa Morton take a roll to verify that we indeed do have our quorum to begin today's meeting.
Okay, and Claudio Gualteri,
Here,
Robert Boris,
Here.
Parisa Charmchi Goodwin, Aisha Clark, Ann Foley,
I'm here.
Tony Harp,
Here.
Representative Cindy Harrison. I know I saw her, so.
Here.
Thank you.
Thank you,
Suchitra.
Melissa, for the stuff.
Oh, you're welcome. Busy time of year. Suchitra Krishan Sarin,
Here.
Matthew Jasinski,
Here.
Christopher Moran,
Here.
Michael Rell, Tricia Orozco,
Here.
Andrew Solner,
Here.
Deputy Commissioner Jody Terranova.
Morning, I'm here.
Thank you. That's it, Claudio.
thanks, Melissa. That brings us to agenda item number 2, which is consideration of the January meeting minutes. These minutes were from our January 24th meeting. I think everyone should have received the draft minutes on February 2nd. We did also make one revision. There was an omission in the attendance, which was corrected and recirculated on April 16th. So just want to make sure folks had a chance to review and are aware of that change in the subsequent version of April 16th, which I would put forward to the board and entertain a motion for approval of such minutes.
So moved.
Thank you. Motion is moved by Andy. Any second?
Second.
Who's second?
Second by Robert.
Okay.
No, I think Christopher did actually. All right.
Either way.
Sounds good. Motion is moved and seconded. Is there any debate on the motion to adopt the January meeting minutes? Seeing none, I'll request that we take a voice vote to approve such minutes. All those in favor of approving the January minutes, please signal by saying aye. Aye.
Aye.
Any opposed? Abstention? Seeing none, so ordered. Those meeting minutes are approved. Thank you. The third item for our agenda is I just want to give an overview of the presentation that we're fortunate to have from the Attorney General's office today, which I think is going to provide a nice level set for a lot of us, including some of the new members that are still new to this work, and a refresh for some of our members who have been around and have some institutional history with the Tobacco and Health Trust Fund Board and the Master Settlement Agreement that provided the main source of resources for this board's work in the past. So we have kindly asked the Attorney General's office, Kara Passero, the Chief of Staff, has indulged us and brought her teammates here to do a 101 on the Master Settlement Agreement, and folks can have opportunity to also ask questions. Once we get through that presentation, I'll then turn it to DPH colleagues to talk about where we are in terms of the RFP process for the recently approved FY23 allocation plan. And we can then start thinking about agenda items for July and the process by which we're going to undertake the next tranche of work when we get as we now are going to be in receipt of an additional $12 million, and there's some interest in moving that tranche in relatively quick succession so that we keep the momentum of this board moving forward. So with that, I will turn it over to Kara, and you can introduce your team and look forward to the presentation on the settlement agreement and the Jewel update.
Thank you. Thank you, Claudio. We really appreciate the opportunity to talk to you all this morning. As Claudio said, I'm Kara Passero, Chief of Staff to the Office of the Attorney General. We appreciate the opportunity to provide a little history about the Master Tobacco Settlement, which is just about turning 25 years old this year. I've only been in the AG's office for about 3 years, but as I've talked to legislators and other stakeholders in that time, perhaps not surprisingly, there are a lot of folks who are making decisions in state government today that weren't around in 2000, and several folks that are. And so we sort of realized in our office that perhaps it's an opportunity to sort of educate and, as Claudio said, level set with stakeholders about what our obligations are under the settlement and how we got here. The obligations under the settlement are like nothing I've seen in state government or budgeting. It opens us up to scrutiny if parties to the settlement question our efforts in this area. And my colleague, Heather Wilson, who's Deputy Section Chief for Tobacco in our finance section, is going to talk in detail about that. So I'm going to hand it off to Heather. Heather has been with the Office of the Attorney General since 1986. And since 2000, she's focused her efforts on the Master Settlement Agreement and electronic cigarettes. So I'm also joined by Assistant Attorney General Diaghi Lubin Farnell, who is going to be helping us out in running our slide deck today, hopefully without much fanfare. So with that, I'm going to hand it over to Heather and Diaghi for slides.
Thank you so much, Kara. Can everyone hear me? Great. And thank you to Diaghi for doing the technical work here. So I'm really thrilled and honored to be asked to do this presentation for you. And I'm excited to give it, and I'm excited to share with you both the history of the MSA, because it's an incredible document, and also concerns that we need to keep in mind going forward regarding the MSA. So Diaghi, do you want to flip the first slide? Great. Well, as Kara mentioned, the MSA is now 25 years old. It was executed in November of 1998 between 52 states and territories and what were then the largest 4 domestic tobacco manufacturers in the United States. And we can be very proud that 25 years later, the MSA is still alive and well. Next slide. So one very unusual thing about the Master Settlement Agreement is that it is a contract in perpetuity. It really should be called a contract instead of a settlement agreement. We should think of it as an ongoing contract because it has very active ongoing obligations for all the parties. It's not like a court settlement we ordinarily think of where it's done after the settlement. The case is over, the case is closed. That is not true with the MSA. And the MSA has 2 major goals. One is to reduce smoking in the United States, particularly amongst youth, and also to compensate the participating states for the costs of illnesses related to smoking that states incur under public assistance programs such as Medicaid. And as I mentioned before, it's a living, breathing contract, and the payments that we receive under the MSA do not come to us as free money. There are definitely strings attached to them. Next slide. Just to review who the parties to the MSA are, as I mentioned, originally there were 4 domestic manufacturers. There have been mergers since then. So at the present time, the remaining original participating manufacturers are Philip Morris USA and R.J. Reynolds. and 52 states and territories joined. However, there were 4 states that had already reached their separate agreements with the manufacturers at the time the MSA was executed. So those 4 states are not part of the master settlement agreement. They have similar agreements, but they each have their own. And those states are Minnesota, Texas, Mississippi, and Florida. In addition to the original participating manufacturers, about 50 other manufacturers, known as subsequent participating manufacturers, joined after the settlement was executed. Included in the agreement were very attractive incentives for other manufacturers to join. Particularly if they joined within 90 days of the execution, and many did, and others have continued to join since then. So at this point, there are about 50 other manufacturers besides the original ones, and they are both domestic and international. Next slide. So just to go over these terms that we keep, these acronyms that I continue to use, we refer to any manufacturer that has joined the MSA as a participating manufacturer, but those are broken down into the original participating manufacturers and the ones that joined subsequently, because they're treated a little bit differently under the MSA. But in general, we can refer to them all as participating manufacturers. We differentiate them from what we call NPMs, which are the non-participating manufacturers, and those are the companies that have chosen not to join. And we interact with them quite differently than we do with the participating manufacturers. Next slide. So let's talk first about what the major contractual obligations of the PMs are under the MSA. They bear both health-related obligations and monetary obligations. The most important obligation they bear that's related to health is they are banned from engaging in any activity that constitutes youth targeting in any way. Because that is the primary focus, is to reduce smoking initiation among youth, because that obviously translates into a long-term healthier population. So there are some specifics in the MSA about what no youth targeting means. It can be all-inclusive, but there are some specifics. One of which is no use of cartoons in advertising, and that eliminated Joe Camel, which I'm sure many of you remember. Also, very limited use of brand name sponsorships of very popular sports activities. So, no more Virginia Slims tennis tournaments. Sponsorship of NASCAR racing is out. Rodeos have been a popular form of sponsorship. All those sorts of activities are strictly limited now. No outdoor advertising, such as billboards or transit ads, and no brand name merchandise, which, is very popular with youth. So anything bearing a logo or a name, like Winston or Lucky Strike or Marlboro, as in the case of this belt buckle you see here, tote bags, T-shirts. You will still find them, as vintage items for sale on eBay, but they cannot be produced or sold or given away by manufacturers anymore. Next slide. Before I should also mention the monetary payments before we move on. As you know, the manufacturers committed to making significant payments to the states in perpetuity. And those payments amount to, if we think about a carton of cigarettes, those payments account for about $9 of the cost of a carton of cigarettes. So let's talk about what all that money adds up to. Next slide. Okay. all the states just received their annual payments from the manufacturers last week for 2024. And in total, those payments now add up cumulatively to over $165 billion that the manufacturers have paid to the states. Each state is entitled to what is called its allocable share of the payments, and the allocable share percentages were set in the original MSA. And they were calculated according to size of state population, but also the degree to which the state contributed to the creation of the MSA and its negotiation. Our now Senator, former Attorney General Blumenthal, was very active in those negotiations. And as a result, Connecticut receives somewhat more than others than it would based only on its size and population. So just to give you an example here, how states break down, California and New York, as you might imagine, are the biggest recipients of MSA money. They each get about 12.5% of the total pool. For California, that now amounts to over almost $21 billion California has received. Connecticut's share is just about smack in the middle of all the states. We are just under 2% of the total, and we have received about $3.2 billion in MSA funds at this point. Wyoming is the smallest settling state, and to date, it has received a little under $500 million. Next slide. So let's talk about this other category of manufacturers, the non-participating manufacturers. Clearly, they have no contractual obligations because they have not joined the MSA, but they are not entirely off the hook by any means because they have statutory obligations. Next slide. So within the MSA itself, one of the requirements for states joining the MSA was that they were required to enact implementing legislation for the agreement. And the Master Settlement Agreement contains a model statute, which is referred to as the qualifying statute because it qualifies a state to be part of the MSA. And our qualifying statute is codified at section 4-28I. And the qualifying statute requires states to enact legislation that will require non-participating manufacturers to set up escrow accounts for the benefit of the states in which they sell. And they must deposit a certain amount into an escrow account for each cigarette they sell in a particular state. So any non-participating manufacturer that sells in Connecticut has an escrow account for the benefit of Connecticut, and they must make deposits into that escrow account. And that money serves several purposes. One, it's a source of recovery for the state if Connecticut should ever obtain a judgment against that manufacturer of the kind of claim that was brought against the original manufacturers. Now, to date, no state has ever been able to mount such a case against a non-participating manufacturer, much less bring it to judgment. So for pretty much all states, those escrow funds are sitting there. Well, after 25 years, if they're not used, they go back to the manufacturer on a first in, first out basis. So in 2026, Connecticut will have to start returning to NPMs the money that they deposited back in 2000. So what is the overall purpose of these statutes? They serve two purposes. One, they have an important public health effect because they prevent NPMs from selling their prices so cheaply compared to other cigarettes that they would be very attractive to youth and other price-sensitive populations. And so the escrow statutes help keep the overall rates of smoking down. The other important thing is that the participating manufacturers, when the MSA was negotiated, were very, very concerned about companies that didn't join the MSA undercutting their market share. When you think that, $9 has to be added to the price of every carton of cigarettes in order to make MSA payments, what if you don't have to make those payments? You can see that that would be a huge cost advantage and incentive for companies not to join. So these statutes help create economic parity between participating manufacturers and non-participating manufacturers. It makes it much harder for the NPMs to undersell PMs and thereby capture greater market share of the cigarette market. Next slide, please. So now we've talked about all the obligations of the various kinds of manufacturers. Let's talk about what the state's obligations are under the agreement. The biggest thing that the states relinquished in entering into the MSA were their legal claims against the manufacturers. And so they gave up their right to pursue legal actions against the manufacturers for health-related claims regarding their citizens. And this is both retroactively and prospectively. So it takes all those legal claims off the table. But the other thing that the MSA imposes on states, and this is through an economic stick, really, as opposed to an actual contractual obligation, and that is that states have to diligently enforce their escrow statutes. As you can imagine, it's one thing to enact a statute, but if the statute isn't enforced, it's of no good. And the manufacturers realize this. So they put this really draconian provision in, which the states agreed to, that states stand to potentially lose up to an entire year's MSA payment if they fail to diligently enforce their escrow statutes during a particular year. So let's talk about this diligent enforcement requirement that is imposed on the states through the MSA. Well, first of all, what does diligent enforcement mean? We don't really know from the MSA. The MSA does not define that term. The only way it has been defined is through disputes between the manufacturers and the settling states over the issue of whether states have diligently enforced. And the MSA provides that disputes like this, which are considered payment disputes, be arbitrated before an arbitration panel. And the rulings that these arbitration panels have made over the years inform us about what diligent enforcement means. So that's how it's been defined. So it's very important for us for every state to diligently enforce these statutes, both because they have important public health effects and because we stand to lose big hunks of our MSA money if we fail to do so. And as I mentioned, the MSA sets up an arbitration procedure for hearing these kinds of payment disputes. So the MSA specifies that an arbitration panel for such a dispute must be composed of 3 retired federal judges. And if a state loses in a diligent enforcement arbitration, it can appeal that decision through its own state court system. Just to make clear, regular disputes like interpretation of contract, let's say an interpretation of some unrelated term of the MSA, those kinds of issues go directly to state courts. But payment disputes, of which this is diligent enforcement is one, always goes to arbitration. Next slide. So as I mentioned, we can cull a lot of information from these arbitrations rulings, which have come down. And one of the major and consistent findings of the various arbitration panels goes to the issue of whose responsibility is diligent enforcement within a state. And they are unequivocal about that. And I have a quote here from one of the decisions. The 2004 panels agree with the ruling of the 2003 panel that both the legislative and executive branches of a state are bound by its MSA obligations. So we are all in this together. Let's break that down a little more. The panels point out that the legislative branch and the executive branch through the governor are responsible for providing adequate funding to the state agencies who are the boots on the ground. And with respect to the qualifying statutes, that is the State Revenue Department and the State Attorney General's office, which are responsible for the day-to-day enforcement of those statutes. Those branches of government are also responsible for enacting any legislation that would enhance and facilitate enforcement of these statutes. So they have legislative responsibilities as well related to diligent enforcement. Talking more specifically about the boots on the ground, in Connecticut, much of this responsibility falls to the Revenue Department because how many cigarettes are sold in a state is calculated through the process of cigarette excise tax. And since Revenue handles cigarette excise tax, they're responsible for monitoring sales of cigarettes. You know, they license retailers and distributors and manufacturers. They collect data on how many cigarettes are sold. They must conduct audits of retailers and distributors and manufacturers. They must conduct inspections. They must conduct investigations. They must hold administrative proceedings when they find violations. And when they can't handle matters through an administrative process, they need to refer those violations civilly to our office or criminally to the state's attorney's office. And because they are doing the day-to-day work, often they are the best source of formulating new legislative proposals for things that would help them do their work better. So Revenue often puts forth legislative proposals, and they must work in very close collaboration with the AG's office because the responsibilities are kind of split between the both of us, and neither one of us can do our jobs without the other. So we have to coordinate with each other. And my office sometimes helps with these functions if need be, but more importantly, we are responsible for making sure that escrow is properly deposited by NPMs. So we obtain information from the Revenue Department about how many cigarettes were sold, and we have a formula for calculating how much money they must then deposit. We collect the bank records from the NPMs. They have to send us their bank records to show what deposits they've made. And if they haven't deposited enough, we have to go after them, whether that means sending them a letter, just requesting it, and they voluntarily deposit the additional amount, or whether it means we have to sue them and bring them to court to get that money deposited. We participate in formulating legislative proposals, and we also bear responsibility for collaborating with the Revenue Department. So the panels have provided a great deal of specific information about exactly what factors they consider important in making a diligent enforcement determination. And many of these just involve, the day-to-day work of my office and the Revenue Department. And really nobody else can affect those things. The one element that I want to talk about here, which is out of the control of those two agencies, is funding. And state arbitration panels look very closely at what funding states are providing for enforcement of the state escrow statutes. Next slide, please. And I just think it's worth reading to you a few quotes from arbitration decisions, which are very damning, regarding states' failure to adequately fund their enforcement programs. Two states that lost in arbitrations were New Mexico and Missouri. And I'm just going to read you a couple quotes from decisions. New Mexico, the arbitration panel found, classified its state cigarette excise tax as a minor tax, and therefore the legislature did not dedicate as many resources to it as it would have a more significant tax program. This had unfortunate consequences for enforcement. And again, the panel said, both the Tax and Revenue Department and the AGO requested another full-time employee to enforce the new escrow measures contained in the 2004 amendment, but neither were funded by the legislature. The limited personnel earmarked for NPM escrow enforcement had an adverse impact on the MSA enforcement results in 2004. And with respect to Missouri, a panel found Missouri's escrow enforcement personnel recognized the need for more enforcement resources, and they requested more resources. For budgetary reasons, however, the state denied the requests. The panel finds that Missouri's record keeping and audit efforts were haphazard and ineffective due to the state's failure to devote sufficient resources to escrow enforcement. So these are very damning. And I can also tell you that arbitration panels have no tolerance for any suggestion that states cannot afford this kind of enforcement, because the manufacturers, as you might imagine, point out that the states are receiving tens of millions of dollars annually from them. And there is adequate money in the state coffers from the manufacturers to pay for this kind of enforcement. So I want to break down in very specific terms how much money can be lost if a state is found non-diligent. It would be an extraordinary thing for a state to lose its entire MSA payment if found non-diligent. But I mean, honestly, it's so much money that could be lost. Any amount, any negative decision would be pretty catastrophic. So I have just put together, these are from the 2004 arbitration. And even though a long ago year is being arbitrated, if a state loses, the money comes out of its current MSA payment. And that's what we're looking at here. We're looking at 3 states that won in an arbitration and 3 states that lost and were found non-diligent in an arbitration. And you can see that prior to the 2004 arbitration, here they're getting their money, and it's pretty steady between 2021 and 2022 for all these states. But then look at what happens in 2023. The states who won their arbitrations actually ended up with a slight increase in their payments. But so they came out ahead. Look at the states that lost. They each lost almost a third of their annual MSA payment for that year. And I want to particularly point out the state of Washington, because Washington's allocable share is very close to Connecticut's. They receive about the same amount of MSA money every year that we do. And you can see that after 2 years of having about $125 million come in, suddenly when that penalty for non-diligence hit, their annual payment dropped to less than $85 million. So the lesson here is we don't ever want to be in their position. Next slide. So states reacted after realizing how terrible diligent enforcement arbitrations are. States banded together and approached the manufacturers about settling these disputes through a multi-state agreement. And such an agreement was reached for the first time in 2013, and Connecticut was one of those. About a dozen states settled at that time. Since then, many, many more states who started out continuing to arbitrate have joined the settlement, realizing the cost and the risk are just too great. So at this point, we have this additional settlement known as the NPM Adjustment Settlement Agreement. And there are now 39 states that are part of that agreement. This map shows them. They are the green states. The red crosshatch states are the ones that are still out arbitrating with the manufacturers. The 4 red states are the previously settled states. And New York and Montana have their own deals going. New York reached a separate settlement, and Montana's Supreme Court exempted it from the whole arbitration process. So they really lucked out. Next slide, please. So this most recent, the current settlement that amends the original MSA, what exactly does it do? It does a good thing and it does a more difficult thing. First, it resolves diligent enforcement disputes for all these signatory states through 2024. Excuse me. On the negative side, the quid pro quo is that states were required, they agreed to expand their diligent enforcement obligation to include not only cigarettes that come through legal channels and bear cigarette stamps, but also contraband cigarettes. So now we have the additional obligation of going out and, looking for contraband cigarettes. And if we find them, our office is responsible for attempting to collect escrow on those contraband cigarettes, as well as the ones that come through the regular distribution system. Next slide. So I want to talk a little bit more about why these arbitration decisions are important, even to states that have reached a settlement with the manufacturers. And that's because this subsequent agreement is not like the original MSA that goes on in perpetuity. It goes on in little increments and we keep having to renegotiate it. We just recently completed our 3rd renegotiation of that settlement, and it only goes through 2024. So we don't know whether the manufacturers will be able to reach an agreement with them again to extend it out further. And so we could be at risk of an arbitration and a finding of non-diligence for 2025 and any future year if we're unable to reach an agreement. Every time we negotiate with them, it becomes a little more difficult. So we just don't know what the future will hold. I also want to talk about why these arbitration proceedings are unique and extremely difficult and are to be avoided if possible. And that is they're incredibly expensive and they're incredibly invasive and intrusive in that the whole subject of the arbitration is how state government runs with respect to this one niche area. And so the actual subject of inquiry is how do we all do our work and how well do we do it? And so that means that for revenue and those of us who do tobacco in the AG's office, any of our emails to each other are subject to discovery. And with respect to legislation, the legislative record is going to be combed in excruciating detail for any statutes that relate to tobacco enforcement. And I can tell you that in other states' arbitrations, incredible amounts of dirty laundry have come out in these proceedings. There have been some very embarrassing things exposed about states through this stuff. So it's just a very, very difficult thing to undergo. And it's unexpected because, you know, in my office, we're used to our communications being covered by attorney-client privilege or deliberative process or something like that. None of those protections exist because our work is the subject of inquiry. In the 2013 arbitration, which is the only one Connecticut had to participate in, I was one of the prime witnesses, and I'm used to being the one asking the questions. In this proceeding, I was the one under scrutiny answering the questions. And that goes for a vast number of state employees who do this kind of work. They are the key witnesses in these proceedings. The arbitration rulings also highlight best practices for enforcement, and we need to cull those rulings for all the information we can get about what should we be doing and what will be expected of us if we have to engage in such a future proceeding. Next slide. So in sum, should we be concerned about the future of Connecticut's MSA payments? Yes, we should, but there's plenty we can do about it to ensure we're in the best possible position if we have to defend our diligence in an arbitration proceeding. I think we've already talked about the fact that how much work they require, the payments require from us to maintain them, and that we may not get a future settlement. The thing I want to highlight here, which Kara alluded to, is that, you know, because the MSA is now 25 years old, there are very few people around anymore who were involved in its negotiation or who remember the early days. And so many people in state government now just don't know where MSA money comes from or any of this information about what is necessary to keep those payments coming. And we have a lot of concerns about the fact that this information needs to be disseminated. We also are concerned about what will happen in the future when money starts flowing back to non-participating manufacturers, when they are entitled to receive a return of their escrow payments. Because that's going to upset the balance somewhat. It's going to undercut the economic parity, or we're afraid it will, because they would be able to get the return of that money and use it to pay future escrow payments. And if they have then that resource to pay their future payments, they may be able to reduce their prices and, you know, undo both the public health benefits and the economic parity issues that are addressed by the qualifying statutes. We have some ideas for ways that we might address that legislatively that we will be working on, but it's a real concern because as NPM market share grows, our MSA payments shrink because NPMs don't make payments under the MSA. So not only do our payments shrink that way, but as the NPM market grows, our diligent enforcement responsibility increases because we have more NPMs, manufacturers, and more cigarettes to enforce against. So we're spread more thin in our diligent enforcement efforts. So those are things that we're concerned about in the future, and we're going to have to work to address. So thank you so much for listening to this kind of complicated presentation. I appreciate your attention and the opportunity to talk to you about this so much. I'm happy to answer any questions. And also, I'd like to pose a question to you for your ideas about how we may be able to best educate decision makers about the state's diligent enforcement responsibilities and the future risks that we face with respect to our MSA funding. So thank you very much.
Thank you. This is Claudio again. What a really thorough and excellent presentation. I think for someone who had some general familiarity with the tobacco master settlement, I think you still added a new dimension of some of the live legal issues and ones that are still surfacing in the future in the next few years here that we'll have to be thinking through. I think just to sort of recap, some of the important points here is sort of the perpetual nature of it being a really unique thing that sometimes we don't always see in settlement agreements. And I think the broad purpose seemed to stick out when you reminded us about how it's broadly to compensate states for their public health programs and increases that may have resulted due to tobacco use is sort of a broad frame that some of the subsequent settlement agreements like opioid have taken a different route. So it's an important reminder of what framework we're all operating under when we seek to redeploy these dollars for cessation and other smoking intervention. I know that Representative Harrison has her hand up, and I imagine others will have questions too, but I'll start with Rep Harrison.
Thank you so much. And thank you so much for this presentation. It really, being new to the committee puts a lot of stuff into perspective. So I have two questions. One, can you send us this slide deck so that we have it for future reference? And also I'd love to go back through it because there's a lot of information in there. So that'd be much appreciated. Thank you. And
Yes.
Did I hear correctly that you said that we have money from the year 2000 that we now have to return? Or did I hear that incorrectly?
Let me clarify that. That money is the deposits that non-participating manufacturers have to make into escrow accounts. So that money has never come to the state. Like MSA payments come to the state and it goes into the general fund. The escrow deposits are sitting at private banks. But they're there in reserve and the NPMs can't touch them. They can't pull that money out willy-nilly, and neither can we. We can only get it for certain purposes like satisfying a judgment. But the deal is that after 25 years, if the state hasn't drawn on those accounts to satisfy a judgment, then the money is released from the escrow account and goes back to the non-participating manufacturer. So that this only relates to those escrow deposits that have never come into the state's possession anyway. Does that make sense? And it's a first in, first out basis. So it's a very gradual thing. They don't get their whole amount back at once. They only get back in 2026, they'll get back what they deposited in 2000. And in 2027, they'll get back what they deposited in 2001. And then it's just going to roll that way forever.
So that means that we, as the executive branch or the legislative branch, have not been remiss in something that we've lost the ability to get those funds, is what you're saying.
Oh, not at all. The qualifying statute specifies that there are only very limited reasons why that money can be released from escrow. The most significant one is if the state gets a judgment, it prevents the NPM from leaving the state and being judgment proof, closing its doors. The money is there for the state if it needs it to satisfy a judgment, but not otherwise. And it's not the responsibility of the legislature to there was no obligation by the legislature to do anything else than enact that statute, which was done in 2000.
Thank you for the clarification, because we always want to make sure that we have done everything we're supposed to collect all the funds that we need. And especially, I'm sure this group would be happy to take on anything that gets left, that potentially could be left behind. So thank you very much. And I look forward to rereading the slide presentation. And this was really a wonderful explanation. Thank you.
Thank you. And I just want to echo on Representative Harrison, spoken as a true appropriator, and I appreciate that. We love to get as much money as due to the state so that we can use it and redeploy it effectively. So very good. I echo that sentiment. I just want to also put another point of emphasis. One, in how we can help you, we have a website we will post. So if you circulate this slide deck, I think the more we can publicly make available the information that you've shared with us to stakeholder groups and other public consumer groups that are supportive of our work, that's one way we can be a partner in this effort. So happy to post that on our website and help even showcase it and distribute it to our broader list beyond just the actual board members of the Tobacco Knowledge Trust Fund. The second thing I want to just pull on Senator Harrison's point to make sure I understand the potential policy inflection point that's going to happen in a couple of years, which is if we are returning these escrow payments to the non-participating manufacturers, that may put them in a competitive advantage vis-a-vis the market where they can reduce their prices and take more market share, meaning that more of them are represented among all the manufacturers, i.e. less manufacturers proportionately are covered under the master settlement agreement. And now we've only been able to get escrow payments into them in the future and more enforcement obligations to do due diligence with those escrow payments. So it's sort of an obligation that accrues to us with less benefit to the state if that happens, and we have to sort of think through what the risks of that are.
Exactly.
Yeah, if I could just comment on that, Claudia, that is exactly it. And that I think is a key takeaway. We may, and we've been kicking around some ideas about how to address that. And so we may come back to OPM and to this group next year with a proposal for consideration.
Okay, thank you. Dr. Sellner, I know your hand was up, so I didn't mean to cut in, but I just wanted to finish that conversation. Go ahead.
No problem. Thanks, Claudia. And thank you so much, Attorney General Wilson, for that wonderful presentation. That was great. I have two quick questions. One is, since the non-participating manufacturers now represent 23% of the supply, have we thought about, and since the master settlement agreement by far is less than the costs of tobacco, the burden of tobacco on our state in terms of healthcare costs and lost productivity and other things, have we thought about, or are we able to bring some action against the NPMs to find them liable for the added cost above and beyond the tobacco settlement dollars? And the second question is, have some states actually sold their rights to the master settlement dollars over time to take a big payout up front?
Yes, let me answer both of those questions. Yes, we absolutely could pursue non-participating manufacturers legally for the healthcare harm that they cause and, the smoking related illnesses that they cause. It's the burden of proof that is the problem with those manufacturers, because you'd have to show that their particular brand of cigarettes had caused the health problems. I mean, these are much smaller companies than, the majors, which originally settled and absolutely dominated the market. I mean, the majors, the OPMs, were 98% of the market at the time the MSA was enacted. They were the whole deal. So our case against them was much stronger. That's why no state has been able to bring such a case, because how do you prove that an individual smoked only these cigarettes, or only these cigarettes caused people's health problems in all those years? I mean, that essentially can't be done. Another issue would be that many of these companies are overseas companies. And we know this from even trying to collect escrow from them. We can take them to court and get a default judgment, but how do we enforce that judgment if they're in Greece, or they're in Vietnam, or they're in Korea? I mean, it's just not possible. So those are the obstacles that we face with, pursuing non-participating manufacturers on these kinds of claims, which are very just, but very difficult to prove. The other question is, yes, many states have done what is securitized their MSA payments, which means that they have kind of sold the rights to them for short-term gain. And luckily, Connecticut has never done that. We were, personally, I feel that that's been a really wise fiscal decision on the part of the state to not, and we've been lucky enough, well, not lucky. I mean, the state's been well managed. We have not been in such a terrible financial position that we have been faced with needing to do that. So, and I very much hope that never comes to pass in the future.
Thank you.
Great. Thank you. And Suchitra, I see your hands up, and I also know you have a question in the chat. So I don't know if you want to verbalize both or a different question, but I'll call on you for a question.
No, I'll verbalize. Sorry, I'll verbalize both. My question for you, thank you, by the way, for a really educational and wonderful presentation. I knew some about this, but I learned so much this morning. My question is the new manufacturers. I was surprised to hear that there was a 23% increase in the number of cigarettes or manufacturers coming in. And my question is, are these all cigarette manufacturers, or are you also drawing the manufacturers of newer products like, the cigars and the cigarillos and the e-cigarettes and everything into this pot? Who are these manufacturers?
Okay, well, first of all, let me say I think what you're referring to are the non-participating manufacturers.
The non-participating manufacturers.
Right.
Yeah.
So they aren't newer manufacturers. They're just manufacturers that have chosen not to join the master settlement agreement and assume its responsibilities. And also, I should have made this clear. The MSA only covers cigarettes and roll your own tobacco. Those are the only products. So cigars, cigarillos, smokeless tobacco, a Skoal, chew, all of that, not covered. E-cigarettes, not covered. It's just really the combustible market that's okay. Covered.
Okay. And, my second question was, it really seems that from your presentation that the enforcement obligation that you were describing, in a way, it was really designed, and correct me if I'm wrong, to benefit the large tobacco manufacturers who kind of contributed to this master settlement agreement, because they are looking for any little mistake that's made by the state to draw their monies back. Am I getting that right?
You have it exactly right. You have hit the nail on the head. That being said, yes, but I mean, what you're saying is true, but we also have to realize that the obligations that the manufacturers assumed in joining the MSA are real. I mean, they agreed to pay huge amounts of money, and they agreed to give up their First Amendment rights with respect to advertising. They agreed to onerous advertising restrictions that do not apply to other companies. So, they reasonably think we gave up stuff. So asking the states to enforce statutes that are going to help us maintain our market share with vis-a-vis companies that don't want these responsibilities. I mean, any of these non-participating manufacturers would be more than welcome to join the MSA anytime. They can absolutely come into the MSA, and they consistently choose not to assume those obligations and restrictions. So if they're making that choice, well then, there is a pound of flesh in there that the participating manufacturers want to extract, but I can't say that it's unreasonable. I mean, they are entitled you know, it was a negotiation. Both sides had to make agreements about what they were going to do to make this whole thing work. So yes, it is for their benefit, but I think it is understandable why they requested those obligations that the states assume.
Thank you.
All right, that's great. And it keeps us right on time. Thanks again for the outstanding presentation and for the board members, your very thoughtful questions that drew out even more conversation around this topic. The next item that we want to tackle is an update on the approval of the 23 allocation plan and next steps. I'll just reiterate the point, which I think we're all aware of now, but on March 14th, the FY23 allocation plan received the unanimous support and approval of both the appropriations and public health committees. I, along with DC Terranova, Deputy Commissioner Terranova, presented on the allocation plan, took questions, and also gave some data on the current state of smoking and tobacco cessation initiatives, as well as some historical perspective on the board and its reconstituting thereof. We were really pleased to have, obviously, a fellow board member, Representative Cindy Harrison, at the meeting and speaking in support and being a good ally internally for the work that you all have done and championing us to move forward. And Michael Rell, another board member, was also in support in the audience, and I acknowledge and respect both of them for being there and being helpful. Additionally, we had support from members of the public, many of the advocates, the public health chairs who often come in on these meetings and encourage us and support us with the legislative process where they can, were there and spoke up and voiced their support. Advocates like Ruth and Bright, who have often attended our meetings and met with us individually, were also in support of the allocation plan. So I'd like to now turn to DC Terranova for a little update on what happens now. We have the green light from the legislature. We're ready to go. We now turn to the RFP process. So DC Terranova, if you can give us an update on the steps to get this money out to community.
Great, thank you, Claudio. So staff members that work on our tobacco prevention program have been hard at work. Many of you have been in contact with Allison Sullivan because there are two different opportunities for board members to participate. One is in preparing the RFP, and so staff has worked on a pretty substantial draft, has reached out to other agencies to see what other groups are doing, such as DEMIS, so that we don't duplicate or replicate efforts, but really identify any gaps in services so that we can make sure that we're really being as innovative as possible when we put the RFP out. So the internal draft should be finalized this week and will be shared with those of you who have said you'd be willing to review the draft, provide feedback, provide input for any ideas that we would like to include. So that is moving right along. The next steps in that process would be kind of after that draft is finalized, with input from the board members that are participating. That'll go through our internal RFP process through our legal office to be reviewed, approval through OPM. And so we expect that we would actually be able to publish this and get it out in the summer. And then in the fall, we would have those applications received. And then those of you who have expressed interest in being on the RFP scoring committee would review and score those in the fall. And then we would start working on the contracts, which again kind of has multiple steps internally to go through at DPH, at OPM, at the AG's office. So that takes a little bit of time. So we would expect the winter or early spring that all those contracts would be signed and that work would begin. So we are ready, we're moving. We appreciate all of you who have expressed interest in helping this move along. And so that's kind of our update on the RFP.
Excellent. Thanks so much for your diligent work. Any questions from board members? Seeing none, I will just note one item that came to our attention during the Appropriations and Public health hearing process was a keen interest in trying to get the board caught up in on a time frame where we're sending our allocation plans closer to the fall timeline as opposed to waiting sort of a full year later. We have had a little bit of delay in standing up the new board, and that delay sort of is making it such that we're running the FY23 one, and we're now about to enter FY25. So I think there was a commitment from all that we want to, now that we have a board and we're highly functioning and we've been able to do one allocation plan under our belt, that we will try to aim for an October submission date per the request of the legislature, so that we can get on a more normal cadence statutorily, where when we would get the money in April and sort of submit to the legislature in short order after that. And I do believe that that's totally feasible, but outlining the steps that we have to do between now and then to make sure we're hitting that target, I would expect that the July meeting would be one where we can reflect on and approve a general process for the next allocation plan, setting us up for some information to go forward to the board and digest before the October meeting, and then ultimately in October, the late October meeting, we would formally ratify a new allocation plan to be transmitted to the legislature. That's the operating goal, just between now and then. So we'll do some work over the summer. I think that one of the things we may also want to think about that I heard in public hearing when the allocation plan was before the committees was an interest in maybe some of the pieces that we really believe are strongly evidence-based. They have a strong track record of making impact. For example, the I Quit line and some recent expansions of that with referrals through physicians and additional counseling and nicotine replacement therapies that we've augmented that program. Maybe we suggest in our next iteration that to give the assurances that the funding will be in place for the long term on some of those, that we suggest a 5-year block of funding from the next tranche of 12 million to ensure ongoing sustainability and signal to consumers and to patients that need that program will be there for them. So not anything we need to decide now, but I wanted to share some of the reflection I heard from the committee and how I processed it so that we can all be thinking about it as we move forward. Representative Harrison.
So thank you for all of that. And I think if I might add, catching up is our ability to continue to maintain our funding. That was also clearly another piece of it. So while we're all going to have to get to work and do this, I think we felt that the commitment to maintain our funding and to move forward was extremely important. So I guess we all took the liberty to make that commitment on all of the board's behalf.
Thank you. The other point I will reflect on is that board members had asked for, in addition to the 12 million that's being deposited this month into the Tobacco and Health Trust Fund, the statute does allow us to allocate any interest earned on the principal. So we will plan to have a presentation from subject matter experts, or at least that information available in July, so we know the entire pot, principal plus any interest accrued, that we have at our disposal to reinvest. With that, Suchitra, I see your hand up.
Yes, this is not directly related to what you said, but I just want to bring it up. Since you mentioned the quit lines, I just heard last week from some of our clinical providers who are on the ground providing smoking cessation services and referrals to the quit lines, that the amount of time that the nicotine patches or the NRTs were provided for had decreased significantly from a 6-week period to a 2-week period. And I wanted to understand what that was related to. Is there a lack of funding right now? Are you all waiting for us to get this new process into place? Because that could significantly, a lot of smokers who are trying to quit will now only get 2 weeks instead of 6 weeks. And that's, to me, is a little problematic.
Yeah, I can answer that question. So yeah, it is exactly because of lack of funding, because we kind of had that gap of prior funding, and that's why we asked for that extra 500,000 to be separated out. I think the timing of when that money came to us was a little bit later than when we would have liked it. And so we did have to cut back to 2 weeks. And now that we have that additional money, we'll be able to extend that back up to the, it was really 8 weeks was what we've been
8
aiming
weeks,
for.
sorry.
Yeah. And so, and that's kind of the exactly to Claudio's point about the long-term sustainability. It would be very helpful to be able to know that that funding is there in the future so that we can maintain that really evidence-based level of service.
Do you hope to be able to raise it again soon to back to 8 weeks?
Yep, it should be soon. As soon as the
Okay.
as soon as the money comes to the
Thank you.
account, we're going back up there. Yes, thank you.
All right, that brings us to the penultimate agenda item, which is public comments. I know we have not received any public comments in advance, but I'm acknowledging that we do have some members of the public who are joining us live for today's meeting. I'll pause for a second. If anyone does wish to be recognized for public comment, we will do so now. Melissa, I'm not seeing any hands raised. So with that, I think we are prepared for the last item on the agenda, which is a motion for adjournment. Do I have such motion?
So moved.
Dr. Salner moves. Second?
Second.
Representative Harrison, thank you for seconding. All those in favor, signal by saying aye. Aye.
Aye.
Any opposed? No abstentions. Good evening, good afternoon, everyone, and hope you have a great rest of the day. Thank you. We're adjourned.
You too. Thanks.
Thank you.